Welcome to R&S Drugstore's annual compliance and safety training. As an individual who provides health or administrative services, every action you take potentially affects patients. Compliancy involves maintaining company standards of conduct, adhering to company policies, and following all applicable laws and regulations. This training will help you understand our policy and procedures, as well as understanding the consequences of non-compliance. Compliancy is interconnected within our pharmacy workplace. We have to maintain all of the policy and procedures for each of these aspects as we go throughout our day to not only maintain compliance, but to also deliver customer service. Combating Medicare fraud, waste, and abuse involves understanding that fraud is caused by intentional deception, waste is caused by inefficiencies, and abuse is caused by bending the rules. To understand your role, it's helpful to see how the pharmacy fits in. R&S Drugstore as a pharmacy is a downstream entity. We provide Medicare beneficiaries with services and supplies, and therefore we must follow the guidelines provided by CMS. Those guidelines include preventing and combating fraud, waste, and abuse. Some examples of fraud, waste, and abuse: billing for non-existent prescriptions, unknowingly misusing codes on a claim. The main difference among fraud, waste, and abuse are intent and knowledge. Fraud is intentionally submitting false information. Waste includes practices that directly or indirectly result in unnecessary costs, and abuse includes actions that may directly or indirectly result in unnecessary costs. There are many laws associated with fraud, waste, and abuse. They are listed here, and if you have any detailed questions that you want to have answered, you can bring them up to your supervisor. There are also penalties and exclusions for not following these laws. There are fines. The pharmacy could be fined, as well as individual employees. There are also penalties of jail time. What are your responsibilities as an employee of R&S Drugstore? Your role is to be proactive in recognizing potential fraud, waste, and abuse in order to prevent it. Identify, report, and management will correct it. How do you prevent fraud, waste, and abuse? Look for suspicious activity. Conduct yourself in an ethical manner. Know fraud, waste, and abuse policies and procedures discussed in this training, as well as standards of conduct, laws, regulations, and CMS's guidance. If you need to report fraud, waste, and abuse outside of the organization, the detailed information is listed here. You can also reach out to the compliancy officer, Samantha Henderson, for a copy. If any correction needs to be made, management will develop a corrective action plan. Knowing the policies and procedures can help stop fraud, waste, and abuse. The law protects patients as well as pharmacies and employees. Fraud, waste, and abuse involves HIPAA compliance. HIPAA is the Health Insurance Portability and Accountability Act. HIPAA safeguards deter unauthorized access to protected healthcare information, and as an individual with access to protected healthcare information, you must comply with HIPAA. HIPAA involves compliance rules: the privacy rule, the security rule, and the breach notification rule. In order to stay compliant, we must follow the rules and understand the different parts of each rule. The HIPAA privacy rule establishes standards to protect PHI, or protected health information, held by entities and their business associates. The HIPAA security rule specifies safeguards that covered entities and their business associates must implement to protect confidentiality, integrity, and availability of electronic PHI. And the HIPAA breach notification rule requires covered entities to notify affected individuals, HHS, and in some cases, the media, of a breach of unsecured PHI. A business associate is a person or organization other than a workforce member of a covered entity. Anyone who comes behind the counter at R&S Drugstore that is not an employee of R&S Drugstore is a business associate, and they must sign a business associate agreement. There are 5 habits that each employee can learn to protect our patients' privacy. These are called the 5 POP habits: keeping patient information away from public areas and visitors, accessing only the patient information we need, never throwing patient information in the trash, storing electronic patient information appropriately, and shredding or otherwise properly disposing of all unnecessary patient information daily. If we keep up these 5 POP habits, then we can avoid the HIPAA breach storm. We maintain a core competency framework for all of our pharmacy staff at R&S Drugstore, and this involves ethics and the avoidance of any conflicts of interest. R&S Drugstore has a code of ethics, and all employees have an overall responsibility to the aspects of facility care and to all facility personnel who provide facility services to the public. Our code of ethics involve protecting confidentiality, encouraging and educating patients, ourselves, and coworkers while maintaining respect, maintaining integrity and honesty, responding to the community needs, and remembering balance and equity when interacting with coworkers or customers or patients. A conflict of interest is defined by any R&S Drugstore personnel entering into an understanding with coworkers, vendors, clients, caregivers, or beneficiaries that may impart financial or other personal benefits to the said personnel, and this may adversely affect the judgment of the aforementioned individual in regards to preferential treatment of the coworkers, vendors, clients, caregivers, or beneficiaries. Management will ensure that all employees involved in the administration and delivery of health care to Medicare and as required by other payer groups attest at the time of hire and annually thereafter that the employee has no conflict of interest as it relates to the administration and delivery of health care. If a conflict of interest should arise, we ask that you notify management directly. We will see if and how we can create a plan to move forward in working together with you. R&S Drugstore's ethics, code of conduct, and standards include cultural competency, and we maintain that our pharmacy and staff will have the cultural awareness, sensitivity, competence, and humility to deliver patient care. Cultural awareness acknowledges ways of seeing the world that may be different to our own. Our cultural sensitivity is interacting with those people who may have a different way of seeing the world. Cultural competence drives the change in practices and behavior by respecting other cultures. And that cultural humility is recognizing that our own point of view is not the only point of view. If we can acknowledge that we have completed all of our cultural awareness in regards to a customer or patient, then we can acknowledge whether care was culturally safe or not. So what is cultural competency? Again, it involves that awareness that there are other cultures, for us to acknowledge the differences, and for us to value diversity. Diversity is a factor in every part of our society and every workplace, but perhaps more than any other business, diversity impacts healthcare. Not everyone needs every product, but everyone needs healthcare. R&S Drugstore strives to prevent harassment and discrimination from taking place within our workplace. Personal harassment is any treatment of a person or group of people deemed as abusive, unfair, or demeaning. Employment discrimination is the unfair treatment of employees based on prejudices. R&S Drugstore takes all allegations of discrimination, harassment, and retaliation very seriously and is firmly committed to ensuring a workplace free of those discriminatory activities. Report any discriminatory, harassing, or retaliatory behavior that you experience or witness to your immediate supervisor or manager immediately. If the problem is not immediately resolved, contact the Safety and Compliance Officer, Samantha Henderson. Harassment becomes unlawful where enduring the offensive conduct becomes a condition of continued employment, or the conduct is severe or pervasive enough to create a work environment that a reasonable person would consider intimidating, hostile, or abusive. Quid pro quo in a hostile work environment is harassment and discrimination that leads to a hostile environment. The quid pro quo is this for that, or an arrangement in the workplace. It's often based on an employee's acceptance or rejection of an unwelcome advance or favor. Examples of behaviors cited by the Department of Labor that may contribute to an unlawful, hostile environment are listed below. These may include, but are not limited to, offensive jokes, slurs, name-calling, intimidation, mockery, or pictures and interference with work performance. Creating an anti-harassment workplace is our culture at R&S Drugstores. Feel free to raise concerns and be confident that those concerns will be addressed. Report any discriminatory, harassing, or retaliatory behavior as described earlier to your supervisor, manager, or safety and compliance officer. Part of our pharmacy compliance involves the Sudafed sales or the meth check. Why do I have to be trained on Sudafed sales? Because the federal law states that you have to be. This training will help you to understand the laws and what you must know before you can sell these drug products. The purpose of the law is that all states and the sellers of these drugs and products must follow the law. Some states have tougher laws, but the current federal law is the one that we uphold, which Oklahoma follows. What are these drugs? They're listed below. If you have any further questions, you can ask your manager. The law is very specific on how these drugs can be stored and who they can be given to. In R&S Drugstore, we store them behind the counter. You must give the drug product directly to the customer who signed the logbook. A photo ID is required that must match the name on the logbook. You must verify that it's the correct date and time. What information must be in the logbook? That is listed here, and your manager can go over this in detail with you. You must keep a logbook, and ours is electronic at R&S Drugstore on the pharmacy software. When is my customer not required to sign the logbook? Never at R&S Drugstore. They always have to sign it. Who can see the logbook information? We must keep it secure, and there are certain restrictions on who can see this. Please refer again to the pharmacist in charge or your manager for all these specifications. How much of these drug products can a consumer buy per day? That's listed here. Here is the table of the grams for the tablets and the liquids, and that's per day. How much of these drug products can a customer buy in a 30-day period? That is listed here, and here in tablets and liquid form per 30 days. Now you should know how to keep the logbook, how to verify information, the drug products that can be stored, where they have to be stored, how they can be given out, and how much a customer can receive. If you have any additional questions, please ask the pharmacist in charge or your manager, as this training is given to all employees but pertains to the pharmacy staff directly. Well, congratulations, you have completed your compliancy training and you are now compliant for another year at R&S Drugstore. Safety training is of the utmost importance, and it involves continuous awareness and preparedness. Personal protective equipment, or PPE, involves gowns, masks, face shields, and gloves, and R&S Drugstore provides PPE to all staff at no cost. Gowns are worn by pharmacists when compounding and technicians or delivery drivers when cleaning up or disposing of any compounding dishes or waste. It's important that you have a proper size gown and that you can ensure it closes properly, whether it closes in the front or back. Mask. When wearing these, use 2 hands to squeeze the nose piece, ensuring it has a good seal. And the bottom of your mask should be under your chin. R&S Drugstore will provide masks when needed. Face shields are worn by pharmacists when compounding or performing vaccines or CLIA wave testing. Technicians or delivery drivers use these face shields when cleaning up or disposing of any compounding dishes or waste. Gloves are worn by all staff when unboxing and packaging medication, available for all staff by R&S Drugstore. Double gloves are worn by pharmacists, technicians, and delivery drivers when cleaning up or disposing of any compounding dishes or waste. It's important to understand respiratory protection that we use at R&S Drugstore, why it's necessary, as well as the proper use and improper compromises. We use dust masks, which are non-valve respirators. These ensure employee safety as well as maintain drug purity. You can adjust the fit by squeezing the nose clip for a more secure fit. Ensure that any dust mask that you use is not dirty or contaminated. If you need a dust mask, R&S Drugstore will provide one to employees free of charge. R&S Drugstore has supplied an Appendix D for all employees, but it is listed here again. Information for employees using respirators when not required under the standard. And this is a mandatory document that we hand out upon initial hire as well as each year for our annual training. You will receive this in the documents that you sign for your training, and if you need any further copies, please contact your manager. R&S Drugstore's policy on COVID-19 is that we follow the current CDC guidelines found on the CDC website, or you can ask what the current guidelines are by inquiring with your supervisor. The symptoms of COVID-19 are listed below, how it is spread, and how you can stay safe by frequently cleaning surfaces and objects that are part of your daily task. If you have symptoms, please alert your supervisor immediately. Use PPE as directed by your supervisor. BBP, or bloodborne pathogens, is the potential exposure to blood or potentially infectious materials. Bloodborne pathogen training occurs upon hire as well as annually each year for our staff. Further explanations of bloodborne pathogen is covered in our in-person training with your PIC or pharmacist in charge. When it comes to bloodborne pathogens, always consider it infectious, regardless of the perceived status of the source or individual. Remember to wash your hands immediately after removal of your gloves and wash any other potentially contaminated skin. Hand washing facilities are readily available in the pharmacy area and the compounding lab. Decontamination. Areas which have been contaminated with blood or other potentially infectious material will be decontaminated as soon as feasible. Eye washing stations are available at store number 1. There is a hand sprayer attached to the compounding sink. At store number 3, there is a faucet attachment in the compounding room. The PPE used in regards to bloodborne pathogens will be chosen based on the anticipated exposure to blood or other potentially infectious materials. These PPE items have been listed below, and your supervisor will go over what should be used in detail. R&S Drugstore follows OSHA standards when it comes to hazardous exposure or HAZCOM. By labeling of all hazardous chemicals, we limit the potential exposure to hazardous chemicals. Every container of hazardous chemicals is labeled, tagged, or marked. Household cleaning products used by all staff must be clearly labeled. Our safety data sheets are available in the pharmacy software. If you have any questions, please ask your supervisor. Unqualified electrical training and principles of fire extinguisher use help R&S Drugstore maintain a safe workplace. There are four main types of electrical injuries: electrocution, electrical shock, burns, and falls. Electrocution is fatal. Electrical protection methods include: never carry a tool by the cord, never yank the cord to disconnect it, keep cords away from heat, oil, and sharp edges, disconnect when not in use and when changing accessories such as blades and bits. Electrical shock can occur by a fall, either indirectly or causing secondary injuries. Workers in elevated locations who experience a shock can fall, resulting in serious injury or death. Remember to be safe to avoid burns, electrocution, shock, arc flash or arc blast, fire, and explosions. R&S Drugstore prohibits the use of flexible cords in these examples as a substitution for fixed wiring, running through a wall, ceiling, floor, doors, or windows, or concealing behind or attached to building surfaces. We follow our lockout-tagout procedures. This is essential for safety procedures and protects workers from injury. If anything is not working, please ensure that there is a lockout-tagout tag applied. In regards to fire extinguisher use, we must identify the different types of fires. We have a Class A ordinary combustible, such as wood, paper, plastic, rubber, and cloth. Class B flammable and combustible liquids and gases. And electrical fires, Class C. Class D is combustible metals, and Class K is cooking oils in commercial kitchens. Use an extinguisher only if you've been trained to use it. Fire extinguishers are for small fires in the early stages. Know where your extinguishers are located. We have several fire extinguishers located in different parts of our pharmacy. In order to extinguish a fire, you must locate the fire, stand 6 to 8 feet away from the fire, stand in an upright position holding the extinguisher firmly with both hands. Use the pass method when extinguishing a fire. Pull, aim, squeeze, sweep. Pull the pin, aim the nozzle, squeeze the handle, sweep the nozzle back and forth. All fire extinguishers should have an inspection tag and trigger seal and a pin. After use, do not place back into service until the fire extinguisher has been refilled. Not all fire extinguishers can be used for every class of fire. R&S Drugstore has several emergency action plans to address disasters, active shooter scenarios, as well as violence. Our emergency action plan is as follows. In the event of a fire or other emergency, including a hazardous chemical spill, all employees and customers shall evacuate immediately. Store 1 employees and customers will evacuate out either the front or back entrance, whichever is closest. The PIC will instruct an employee to call 911 and ensure that all upstairs employees have been accounted for. The PIC will contact the upstairs employee and make sure that an employee has pulled the fire alarm. All upstairs employees and any customers are to meet at the back parking lot at the light post. If they exit through the front, they must walk around the building. Employees and customers at store number 3 will evacuate out either the front or back entrance, whichever is closest. The PIC will instruct an employee to call 911, and the PIC will ensure everyone is accounted for. All store 3 employees will meet and assemble in the front parking lot at the light post. They will walk around the building if exiting out the back of the store. During a natural disaster or tornado, remain alert and watch for approaching storms. Watch the sky and stay tuned to the NOAA weather radio, commercial radio, or television for information. In the event of a tornado, Store 1 employees will go to the designated area, which is the wall immediately outside of the women's restroom. Upstairs and office employees will also go to the Store 1 designated area. Store 3 designated area is the wall immediately outside of the employee restrooms. In the case of violent activities such as rioting or an active shooter, The facility manager and supervisor will instruct all employees and customers to escape if safe to do so, or to move to a safe location. External doors will be locked if there's a threat externally, if not done so already. And the facility manager or supervisor or their designee will call 911. In the event of emergency, the routes to exit would be the nearest available marked exit in either the front or the back of the stores. Fire extinguishers are provided in the workplace for employees' use. In the event of a fire, an employee who has been properly trained may use an extinguisher to attempt to extinguish the fire. Store 1 fire extinguishers are located at the front entrance in the fountain dishwasher room and upstairs in the front staircase at the entrance of the storeroom. An upstairs fire extinguisher is located in Store 1 at the t-shirt sink and by the front stairs storage room entrance. Store 3 fire extinguishers are located behind the front checkout counter, outside the post office on the wall next to the storeroom doors, and across from the women's restroom on the wall next to the storeroom doors. If an employee is certified to perform CPR or first aid, the employee may do so in good faith. Once safe to do so, a supervisor will contact or designate someone to contact emergency services. Please reach out to your supervisor if you have any additional questions. Active shooter response is as follows. Run or escape if possible. Your second option is to hide if escape is not possible, and your last resort would be to fight. Be aware of your environment and any possible dangers. If you see something, say something. Call 911 when it's safe to do so. Understanding the pathway to violence model can help to prevent targeted violence events. As the threat landscape evolves, acts of targeted violence continue to impact the safety and security of our communities. What are the warning signs? There are stresses, triggers, or warning behaviors. The pathway to violence model starts out with personal grievances, ideations, research and planning, preparation for violence, probing, breaching, and then an attack. Escalation pathways can be avoided by changing our vocabulary. We can help with anyone who might be a potential violent threat. If we change our language from active shooter to assailant or lone wolf to offender, we might be able to de-escalate a situation. Everyone can play a role in preventing violence in their community, and early detection and reporting of threats or observable behaviors that may concern others are key to prevention. Warning behaviors should be viewed within the totality of circumstances. Please report to your supervisor immediately any potential violence threats. Congratulations, you have completed your R&S Drugstore safety training. If you have any further questions, please contact your manager or your safety and compliance officer, Samantha Henderson.